Hello.
Good evening. Hello, hello. Good evening, Dr. Forum.
Good evening. How are you, Meena?
All good. So good to see you here. I'm so glad
Same
you're
here.
joining us, yes, for our 10th episode of the Learn with Starchild series. And I feel so good about that. The 10th episode. Isn't that great?
It's just amazing. Your efforts have been just amazing.
So today, people, we have with us Dr. Forum Gada. Dr. Forum is a dentist who believes in painless dentistry. And today she is here to discuss with us issues faced by children and even teens. So thank you so much, and I'm so glad you are here, as I said, to join, to share your knowledge with all our parents and viewers.
Thank you for inviting me and thank you for taking out time for doing such lives.
Thank you, thank you. So let me start with my first question. So we are all, of course, afraid of the big bad dentist. You don't need to begin there. However, I'm sure all of us are, afraid of the dentist. And probably children also carry that fear. However, it is, of course, necessary for them to see the dentist quite often. So, when should a child see a dentist? When is it necessary for the parent to bring a child to you?
So ideally, from the very first birthday or once the first tooth of a child pops out, it's important to start taking child to the dentist because like we take the child for other doctor checkups like an eye checkup or a skin checkup, even if they don't have a problem, we have to inculcate that in the child that this is normal. It's not that when we have a problem, we are going to be visiting a doctor. So in the same way, even for the dental thing, they should visit every 6 months or at least once in a year. Okay, and yeah, so that is about visiting a dentist. And if that is missed by any chance, then once in a year is a good time to visit so that if any problem goes unnoticed or there is a small issue which does not cause a pain or a problem, it can be handled quite smoothly at that point of time.
And what possible issues do you see happening, in a child's teeth or tooth?
There can be multiple things, but first and foremost is while the tooth erupts, that is when the tooth tries to pop out in the mouth. There could be some swelling or pain or discomfort in the child, which is usually seen in most children. Second thing could be having a cavity in, or a black decay in the mouth. Okay, it could be a small decay and it can go up to a big decay, which can cause a gum infection also. So it has, it can be a little small decay or a black dot seen on the tooth, and it could be really deep inside because it follows a triangular fashion. So up it can look very small, like an iceberg. Tip of the iceberg is very small. That way it can look really small up, and when we actually treat the tooth, it has almost reached like half the tooth many a times. So that is the second problem that is seen. Third is the gum issue. Many children try to brush by themselves or at times even in a hurry, even if
Yeah.
a parent or an adult is helping. Some areas of teeth are not brushed that well. So there's a lot of tartar buildup or a deposit around the teeth, which looks a bit yellowish. That is one problem, that it affects the gum and there is bone beneath the gum. So it can cause gum and bone disease. And fourth thing is many times the permanent teeth, when they erupt, they go unnoticed. Some permanent teeth take place of the earlier milk teeth. Matlab the milk teeth fall and the permanent tooth comes. But there are a few permanent teeth who come by themselves. They do not follow falling of a milk tooth to come. They come
Yeah.
directly. So mainly those kind of teeth are unnoticed and they are presumed to be milk teeth which will fall one day, but they are not milk teeth. And eruption of these teeth can start as early as 6 years age, and many children face problem because of mistaking this permanent tooth with a milk tooth by the parent or an adult or anybody in the house.
Right.
So these are the problems that are often faced.
Yeah, but now sometimes, I mean, this is, a question which I always wonder about is how important are those milk teeth? Now, suppose I have a 6-year-old child and he has a cavity in his milk teeth, right? Now the parent assumes that they're just milk teeth, they're going to go away. So why
Right.
bother with it? So should they bother or not?
So it's a very big myth that milk teeth are not important. Somehow we, as a generation of Indians, have been following this that milk teeth are not at all important, but that's not the fact. Assuming that the 6-year-old has pain in this side of the tooth since 6 years of age, and this tooth is going to fall down only at 12 years of age. So now the parent is going to wait and keep giving painkiller syrups till the tooth falls, which is still 12 years of age, meaning that the child is going to be constantly getting allopathic syrups or medicines for the toothache for 6 long years, at least once in a month or twice in a month. Okay, so the medicine that goes in does harm, has its side effects is one thing, but the child will not eat on this side for 6 long years. Then when the tooth falls and when the permanent tooth is going to come, is the child going to remember after 6 years to eat on this side? No. The child will be habitually eating on the other side, and it will cause problems in future for sure. Teeth problems, jaw problems, ear problems, everything. So, in my opinion, as long as the tooth is in the mouth, we should try and save it. If by any chance we cannot save the tooth, a milk tooth, if the tooth has to be removed to cure the infection at that moment, since it cannot be saved due to any particular reason, a space maintainer is very important. Because keeping a rotten, decayed, or a painful tooth in the mouth, the child will just not eat on that side.
Okay. I understand.
Yeah.
I understand. Yeah, but sometimes
So
the pain.
parents, please.
Yeah.
So pain is something that comes and goes, be
Okay.
it your tooth or be it any other part of the body. The only good part about the mouth is you can always eat from your front teeth, your left teeth, your other side teeth. Something or the else you can do, or you can have liquids, or you can eat soft food. But that eventually is going to affect your entire health, because what you eat is what you are. So eventually, if you're not going to be able to chew certain kinds of food, then that's going to obviously show up on your health. And more importantly, if one tooth is not, taken care of at the right time, it's definitely going to affect 3 or 4 teeth after a few years. This is what we have really observed, because if you tend to be someone who is not attentive to your teeth, it's going to come back.
Right.
And then you feel that the dentist is very, very expensive.
Yeah, true, true. And so you mentioned something about space savers. What did you just mention?
Yes. I said space maintainers, meaning if for any milk tooth, if a milk tooth falls, and say if it's in a younger child, like 5-year-old or 6-year-old, if we have to remove a molar, but the permanent tooth that follows that milk tooth comes only at the age of 11 or 12, we have to maintain that space. We cannot let that space be closed up, because when the tooth is removed, the neighboring teeth, which was straight, tend to drift into that space. The upper tooth tries to come down. So that space starts closing, and there is no space for the permanent tooth to come when the child is 11 or 12-year old. The tooth either gets locked or it comes in a wrong position. So it's very important to maintain that space. For any reason, if the tooth is removed in that child, there is something called a space maintainer treatment that should follow after the removal of the tooth.
Okay, okay. So I'm also learning a few things which I never knew about. uh, okay, so so the next question is, like braces, something which none of us like. I mean, kids especially, they feel a little, they're not very happy with the way it looks. But
Yes.
probably they're often necessary. So when are they necessary, and how does a parent, know about it?
So if one of the front teeth is not looking very aligned, or if the child is constantly complaining of headaches, or jaw aches, that is the time when you know. And of course, the dental checkup is also very important, because the posterior bite, the bite of the upper teeth to the lower teeth of the backside teeth, is very important to be checked. If it's not in sync, the upper and lower teeth are not closing like they should, that is very important time when a braces treatment should be considered. And about what you said, that they are very shy about having the metal on, the, things have changed. Whenever you want to get fixed braces done, you can always get ceramic braces done, which are almost they look like your natural teeth. And even if you don't want to go for fixed option, you can go for aligners, which are the most recent advances of dental industry, which have benefited teens, children, and older adults also, meaning people from 10 years to 50, 60, 70 years of age can get their teeth aligned with the help of aligners in a matter of
So,
few months.
okay. So what exactly are they? I mean, are they similar to braces or is it something different?
So aligners, I'll just show you some pictures. Yeah, I'll just turn my camera. So these are the traditional braces, like you see the metal blocks. These were
Yeah.
like the traditional braces, okay? And these are the
Yeah.
aligners where an acrylic tray is put onto your tooth. And this acrylic tray actually helps us, there are a set of trays. It could be 10 trays, 20 trays, 30 trays, depending on how much correction of the teeth needs to be made, how much spacing or how much crowding is there in a child or in the adult. Okay, depending on that, after a scan, we can tell you how many trays could be needed. So after wearing each tray, the teeth are going on getting aligned. This is similar to braces treatment, but the only difference is that these are virtually invisible. Okay, when you wear it, nobody can know that you are wearing or you're getting your teeth corrected. There is no disadvantage to the tooth because we are not touching any part of the tooth, we are not reducing the tooth. Third thing is that it is quicker, faster than the braces because your appointments to the dentist are reduced and you are wearing the trays and you're giving all the trays beforehand. So from the tray number
So,
one to the tray,
yeah, I'm sorry. Yeah, I'm sorry to interrupt, but I don't understand
yes.
this. So when you speak of trees, is it like you're doing one tooth at a time, or they just wear the
No,
whole thing?
it's the whole set. I'll just show you. So as I showed you, so this particular acrylic tray which you can see below the tooth, it extends from one side to the other side. It's a U-shaped tray which extends in the whole mouth from entire upper
Okay.
and lower. So you wear
Okay.
it fully in the mouth and it moves the teeth like the braces would. But in the braces, the orthodontist or the braces doctor tightens the wire every month, which causes the teeth to move. In aligners, that is not required. So the whole set of trays is given to you. There is no time wastage, there is no missed appointments, there is no food restrictions, there is way less discomfort, and you can virtually eat everything. In braces, you are not allowed to eat a certain kind of foods, but in
Oh,
aligners, you are allowed to eat everything.
wow. I mean, there's
Yeah.
so much. I always wonder at, the advance in science and technology. So it's
Yes.
amazing.
And we should
So,
definitely make the most of it because at times kids are shy that now I have come to college, how will I wear braces, this, that. But this is a lifelong correction. This is going to help you chew better, look better, be confident, eat properly, have less problems in future, have less cavity issues because the teeth are aligned. So definitely one must consider aligners if they are facing any crowding or spacing.
yeah, absolutely. I agree with you. And as I said, all these are new technology which I'm totally unaware of until I hear you speak of them. And also, I was reading and I found there's something called the sports card. And, so what are all these new things?
Yes. So nowadays, a lot of children are playing sports, be it girls or boys. They are all at par and they are playing a lot of outdoor sports, contact sports, what we call, where, they might get hurt. Sometimes some kids just come with a tooth, just popping out of the socket and the whole tooth coming out. At times it's chipped, so these are contact sports. Such injuries are bound to happen because of the nature of the sport. So there is something known as sports guard, which protects the teeth of the child while they are playing the sport. So they are custom made sports guards which the child can wear while playing the sport, so that there is no injury to the tooth, to the jaw. I'll just show you the picture of it. So this is a sports guard which can be worn while the child is playing. Say your child is playing football or something like that, so they can wear this while playing it. So even if by mistake somebody hurts the child with a ball, or by mistake it's a player's game. So if the child gets hurt, their teeth and jaw are not affected. It does not cause a permanent damage to your jaw or teeth. So these should be considered if your child is playing any outdoor games, any contact sports. Please do get a sports guard made for the child.
And how expensive is this? Is it
So
something
it can cost between 3,000 to 5,000 rupees. It depends on, what material we choose. If you want your child's name to be written, or, those kind of customizations. So all those things are involved in this. So yes. So that is on the fancier side. If you want a simple one, then it can cost you anything between 3 to 5,000. Yeah.
and how long do they last?
So as long as the teeth don't move, it lasts. So if it's someone who is a little child, whose permanent teeth are yet to come, then you might have to get it made again. If it's a child who is like 12 years old, 11 years old, whose all permanent teeth have come, then you need not remake it until it gets damaged or really bad shape or something like that.
Okay, okay, fine, fine. Well, yeah, I'm so glad I'm talking to you, and I'm sure, this will be very useful to many parents who are like me,
Definitely.
maybe don't know about these things because, as for me, for example, I have a much older child now. So I've not needed to go to a dentist very often and don't know about these,
But then
new.
that's a myth. That's a myth. You should visit a dentist every 6 to 12 months because the problem doesn't start when the pain starts. It starts much before the pain starts.
I went through all this during the pandemic. I had a terrible tooth issue. And of course, the dentist was not even available at times.
Yes,
And
right.
yeah, uh, initially it was just, sort of avoiding the pain. And of course, later on when I went, I had to have a lot of visits and a lot of things had to be done. But I think I'm done with now. so, so, is there anything else that you would like to tell our viewers or our parents?
So there are a few myths about dentists that, dental treatments are going to be very painful. Dental treatments are going to be very uncomfortable. I'm going to be, waiting in the waiting area for hours together for my turn to come. But I would like to say that yes, such things persist in some places, but not everywhere. So, you should look out for a dentist who has a low waiting period, who gives appointments, who you can check out photographs on Google about, the interiors of the clinic, what they do to soothe you. Like we try to play music whenever we are doing treatments for patients. That's not just for us, but that's to calm, the mind of the patient. It really helps. It really helps. And with the, newer technologies, we are able to give painless anesthesia, and we are able to minimize the pain as much as possible. Like root canals in earlier days required 3 or 4 appointments. We are doing root canals, for almost all our patients in single appointments. And so much time is saved, so much efforts are saved, so much pain is saved, so much painkiller consumption is saved because of this. So rather than being scared, just step out, just read the reviews on Google, check out, and if you don't know anybody, you can always message us on Instagram, on our Instagram handle, and we'll be more than happy to help you. And almost all dental treatments are now solvable without any pain. So don't be scared. That's the only thing I can say. And yeah, apart from that, please do visit your dentist at least once in a year for a routine dental checkup done. Get a teeth cleaning done once in a year, minimum. And if you have any doubts, please DM us.
Thank you. Thank you so much for your time and for all the knowledge that you have shared. So, thank you so much for being there with us today.
Thank you, Meena, for having me, and thanks for all your efforts for spreading so much awareness of array of topics. I have benefited. I'm sure everybody will be benefited, and yeah, you must follow Meena ji for more such things. Thank you so much.
Thank you. Bye.
Okay, bye.